Hello, and welcome to the July OhioISP gathering supporting QIDPs and SSAs. My name is Amanda Brooks, and I'm a Regional Support Facilitator with DODD. This recording is for both QIDPs and SSAs, and we will discuss Technology First, the Technology First rule, and how technology is interwoven throughout the OhioISP. Joining me for this recorded gathering is Leslie Powell. She is also a Regional Support Facilitator with DODD, and we have Keith Banner, Community Life Engagement Statewide Manager. We are excited about the new technology rule and how OhioISP directly aligns with this rule. The OhioISP has prompts to explore technology throughout a person's life and increase independence. As in recent months, this July gathering will take place in this recorded video format. We will have regional office hours where you can discuss and ask questions, which will be conducted later in the month. The dates and links to the office hours for SSAs and QIDPs can be found on the OhioISP webpage at dodd.ohio.gov/OhioISP. They can be found under the Regional Support Gatherings. We want to take a moment and say thank you for everything you do and for joining us for this month's OhioISP gathering. Quickly, before we dive into technology, we wanted to briefly remind you of what was discussed during June's gathering. During June's gathering, we had two separate recordings, one for SSAs and one for QIDPs. Overall, this was part 2 of outcomes, which included discussing meaningful outcomes, experiences, and identifying services and supports using the OhioISP. For QIDPs, we also made the connection to incorporating Medicaid requirements and compared the standard IPP process to the OhioISP process. If you haven't had a chance, please be sure to go back and watch June's recording or any other previous recordings on the OhioISP webpage under Regional Support Gatherings. Without any further ado, we would like to introduce Keith Banner. Keith works with DODD and is the statewide manager of the Community Life Engagement team. We want to extend our gratitude to Keith and thank him for sharing his wealth of knowledge regarding technology and the Technology First rule.
Thanks for having me. I really appreciate it. We're going to walk through the Technology First initiative and the Technology First rule and how they kind of correspond and align with the OhioISP. So Ohio's Technology First is an initiative. It's not like a program. It's an initiative, a philosophy to help people ensure that the folks we support have increased opportunities to live, work, learn, do everything else anybody else does with the assistance of supportive tech. And we kind of live lives that are really kind of tech-centered. A lot of the times we all have our phone, we all have different ways to kind of interface. So that's a major, one of the number one reasons for a Tech First initiative is to make sure all the people with disabilities we support have access to that. And then also to promote the supportive tech so that Ohio can take key steps toward solving the DSP workforce emergency crisis and trying to use that as a way to kind of be a part of the solution to that issue. So those two are really the top 2 bullet points, and I'm going to ask Mandy and Leslie maybe to take on how the OhioISP kind of works that into the way y'all are figuring out things.
Yeah, thanks, Keith. So the OhioISP, throughout the assessment, asked questions in regards to technology at the end of every assessment section. There's 7 assessment sections, and at the end, it references and has the team explore how technology might be able to assist the person within that area, and if technology is being used, or if maybe a technology assessment needs to be explored for the person.
So our tech priorities here at the Ohio Department of Developmental Disabilities are technology to increase safety and independence and control, and that's for the people we support, people with developmental disabilities. And we're also prioritizing technology as a solution to meet a need, like the workforce crisis I just mentioned. And then third, we want to focus in on and pivot toward technology as a solution across every age in the lifespan, from early intervention through school, through transitioning to adult life to adulthood. So all those 3 bullet points there kind of point out the way we're looking at and prioritizing supportive tech. So why, right? Why technology first? Well, I think I mentioned this a couple of slides ago, but everyone on planet Earth is kind of, their lives are influenced and a part of a technology ecosystem, right? From smartphones to tablets to streaming, whatever. So we want to make sure that the people we support with intellectual and developmental disabilities are included in that kind of that social movement, that cultural movement toward using tech in innovative and life-shaping ways. So basically, another reason for Tech First is just to make sure that the people we support are a part of this technology boom. I wanted to mention this and pull this quote out from Judith Heumann, who's a disability rights activist. It's, for most of us, technology makes things easier. For a person with a disability, it makes things possible. And that's really a good way to kind of think about, as you're approaching planning supports for people with developmental disabilities, is the possibilities that supportive tech can provide, just in a spectrum of all kinds of different ways to look at supports. But looking at tech first kind of also opens up all kinds of doors and possibilities that you wouldn't have had in the conversation unless you really thought about it and talked about it. One of the ways that we're kind of putting the technology first philosophy and initiative into practice, into implementing, is through a task force that was kind of instituted in this year. Basically, it pulls together all kinds of agencies across the spectrum, state agencies, to make sure we're focused on technology as a benefit and a support for people with disabilities. So these reps from all kinds of different organizations kind of got together, and they prioritized and made recommendations to kind of make sure Tech First is the way that we're proceeding all together as a state. So those recommendations included providing opportunities to invest and pilot in innovative technology solutions for people with developmental disabilities, some of the grants that we do through DODD. We want to elevate people with developmental disabilities in the conversation in smart cities, Drive Ohio, Broadband Ohio, and technology initiatives through Innovate Ohio. We want to develop a communication plan for everybody around the purpose and importance of tech, and advance the use of Data Ohio, the Data Ohio platform, to evaluate available tech-related services. We're going to evaluate available tech-related services to make sure that they're efficient and effective. We want to work collaboratively to increase provider capacity, develop a state-level interagency agreement among all the Tech First Task Force agencies so that everyone's working together to set common policy and definitions, training material, and benchmarks. We want to develop and implement rules outlining Tech First, which I'm going to go into our initial Tech First rule here in a sec. Ensure regular engagement with everybody out there, people with disabilities, families, teachers, DSPs, anybody that has anything to do with the system, around what are the needs of supportive tech in your region and in the state. And basically, we want to also, at the end of the day, that task force engaging 2 times per year with an advisory committee made up of all kinds of different stakeholders, just to make sure we're staying on track and identifying new obstacles and new opportunities as we move forward. And here you'll see all the agencies I was mentioning in the other slide just previously. These are all the organizations and agencies that are a part of the task force for Technology First, and they include DODD, Office of Innovate Ohio, Department of Ed, Medicaid, Job and Family Services, Aging, Mental Health and Addiction Services, OOD, Opportunities for Ohioans with Disabilities, Transportation and Health. All of these organizations and agencies together kind of pointing toward the future of tech. So a part, again, of this whole technology first philosophy and initiative is we instituted and published a rule that came out in, I think, at the end of April, for county boards and ICFs and developmental centers to kind of think about and foreground and be intentional about using supportive tech and tech first as a way to plan and provide services. And one of the best definitions in the rule that we can really kind of take to heart is what technology solution actually means. And basically, I'm going to read this to you because it's very important. Any product, device, equipment, or service used to maintain, increase, or improve the functional capabilities of people with developmental disabilities that's deployed in accordance with applicable fed, state, and local rules and regulations. The efficacy of a technology solution is subject to review and approval by the department. Basically, we're looking at, in rule and in reality, using tech as a solution to solve problems that maybe we hadn't been able to before. And so the rule itself kind of hones in on what planning means if you're focused on a technology first kind of way of having a conversation and putting things to use. So we want to make sure that technology improves quality of life and gives personal freedom, and that it can increase the person's ability to communicate, right, with others, increase opportunities to live, work, learn, thrive, play in their lives. So all of this stuff is really ground level about how do we help people have better lives, have more control, have more independence, and have more fun and more ability to do the things they want to accomplish. So a parent once told me about her son in technology. He's created a lot of destiny by his willingness to take risk and my willingness to allow him to take risk. And that's a very powerful statement when you kind of plug that into this tech first idea. Sometimes we all get scared to do or try new things, and we just need reassurance and support from the people closest to us to make it work. So sometimes, though, on the other hand, we want to try new things, and people close to us don't think it's a good idea and don't want to give support because they feel it might be a bad decision. But in the long run, we all learn from successes and failures and mistakes, right? So this is called the dignity of risk, and the right of any person to make choices and to make mistakes is a part of that self-directed living. And when you look at how tech can kind of increase independence, increase the quality of life of folks, it really is a lot of the times worth the risk. And if you talk about it in a way that's not just about the risk, but also the benefits, you're going to really start seeing opportunities and avenues you've never gone down to help people kind of live better lives. And so this is kind of a breakdown of the technology first rule and the way to use it and to reinvigorate planning, basically. So when you're looking at a technology solution to determine whether it's effective and should continue, the person and the person's team really should consider his or her experience in terms of achieving outcomes, whether the technology solution enhanced that person's health and safety, and whether additional support's needed to facilitate use of the technology solution, like scheduled battery replacements or more frequent communication with the technology solution vendor. So walking through how to use the technology to support someone, and then also how to make sure you're including it as one of the first options, that's really important. So whether the technology, also need to consider whether the technology solution is reducing dependence on staff by increasing that person's independence and without having the effect of isolating him or her from the community or preventing them from interacting with people with or without disabilities. And also kind of looking at, when you're reviewing technology solutions, whether the individual has a desire to continue to use the technology solution. So best practice for tech, right, is probably best practice for any kind of outcome-related service. It's to make sure that the person is using it, that they want to use it, that it works, and that at the end of the day, it's improving their lives around being more independent and actually making things better for them, and maybe even increasing the person's ability to make other things happen and accomplish other greater things.
So Leslie, as I said earlier, the OhioISP does a really nice job to make sure we're exploring technology throughout a person's life. And at the end of every assessment section in the assessment summaries, we have the ability to list technology solutions that have been explored for the person. You see here, the top of the slide, it says list technology solutions that have been explored, and make sure you're detailing those solutions that might lead to that person's increased independence. And it does indicate if there are no viable options, be sure to indicate that as well. You see the box the second box then that's highlighted in orange regarding technology. So this is a good reminder that as you're going through the assessment, if the team talks about the person benefiting from technology in some way in this area of their life, or maybe they already currently are using technology somehow in this area, make sure you're checking that box. So then when you get to planning, that's a reminder that technology is being used or technology needs to be explored in that area. And then finally, that third highlighted box is technology assessment. So maybe the team talked and they feel that a technology assessment would be a benefit to the person. Be sure to check that box to indicate that. Or maybe the person has had a recent technology assessment that you want to include and reference within the Ohio ISP. You can check that box here as well. So we list out the 7 sections of the Ohio ISP assessment. And Leslie, can you maybe talk a little further on that about exploring technology throughout the person's life?
Absolutely. And you really want to think about technology through the person's entire life and just not focus on just home or community or, at work. And so when we look at the assessment sections like communication, what kind of technology could be used for communication? And we think about the iPad, Alexa, video calling, smartphones. And then when we think about advocacy and engagement, there's applications for all kinds of things like Facebook, TikTok, Instagram, Messenger, and going forward and looking at safety and security. You can look at Ring cameras, smartwatches, GPS watches, wearable technology, and looking at social and spirituality. Are there church websites that they can attend church online? Are there church Facebook groups? Daily life and employment. There's all kinds of smart appliances like stoves and refrigerator, smart houses. Community living, you can use technology through neighborhood Facebook groups, next door neighborhood apps. And healthy living, you got medication dispenser, telemedicine appointments. There's just all kinds of different technology things that are available, and they are changing daily.
Yeah, and I think it's good to note, that this is not an all-inclusive list of all the technology that's available. It's just to kind of get us thinking. Yeah, and
yeah, absolutely.
I think it's helpful to know too that, no one person is expected to know all the technology that's available, but to be curious about what might be out there and to be able to connect with those people that are experts. So connecting with the technology vendors and thinking of technology that everyone uses, not just technology that's disability specific. Really encouraging, and I know Keith will talk in a little bit about the rapid response, and that's super helpful to connect with those technology vendors as well.
Absolutely.
So this next slide, let me introduce Lou Decker. Lou lives in an ICF. And if you are interested, you can see Lou's full plan on our webpage under the Ohio ISP example plans. So as we discussed on the previous slide, at the end of each assessment summary section, you will find technology information. In Lou's communication assessment summary, the box is checked off. This will assist the QIDP or the SSA when moving forward into the planning stage later. So we're moving down to the technology solutions. What does that mean? We really asked the SSA or the QIDP to list any technology solutions that might have been explored in the past, what technology is being used successfully now, what is working and what didn't work. I do want to remind all of you, if technology didn't work for someone for the first time, don't give up. There's always new and different technology that gets created. In Lou's case, the QIDP indicates the pass, Lou tried using a communication device and it just didn't work out. The team felt at the time that Lou could use some assistance with communicating. Although the team felt that this would help increase Lou's independence, help him express himself, no one really asked how Lou was feeling about using that device. And as you can see on the slide, the QIDP stated that Lou had no interest whatsoever to use that communication device. So this is important because part of Technology First rule states that the individual needs the desire to continue to use the technology solution. So when you think about that, although the team wanted to help Lou, the technology solution didn't really work out. In Lou's case, it could have been a few reasons. It could have been too complicated for him. He wasn't asked if he was ready for technology. I mean, there could be a lot of reasons. But we want to remind our teams to, just because technology was tried once for one particular thing and it didn't work, there might be some more exploration that you need to do. Can technology be used elsewhere in life? How can you find this? Well, you're just going to simply go back through your assessment and see if there's anywhere that technology could be of a benefit. We know that teams have conversations and they do some observation and have assessment information. And we found out that Lou really likes to listen to people having conversations and watching others. So is there technology that can assist him with that? Maybe it's a good time to try some newer technology, possibly using an iPad. Before the team can make some assumptions, we might want to take a look at if a technology assessment can be completed. In Lou's case, the team did agree that a technology assessment would be a good start. We want to make sure that Lou is successful and to make sure that the purchase of the technology when made is going to go for good use. So checking off the technology assessment indicates that the SSA or the QIDP will need to have an assessment completed. And you can do this by reaching out to a technology vendor or utilize the rapid response system to contact a vendor for further assistance. Moving from the assessment to the plan, you will find some service and supports. On the left-hand side of the slide, you will see service and supports, calling out additional supports, family, friends, community resources, and technology. And so in this section, we are again looking in the assessment area in the plan concerning communication. And Lou's assessment information, it is noted that Lou's niece knows a lot about technology and wants to be an active member of the team. She has communicated with Lou and his team that she wants to assist with any updated apps, any resources that may help Lou explore technology and more. With that information, we know about who's going to support, under who supports. It would list her name and what does that support look like and when and how often does it happen. And this just kind of tells everybody exactly what's supposed to be happening and when. Remember, not everything has to be a paid support. On the right-hand side of the slide, you will see service and support professional referrals. This is like medical professionals, technology, therapists, etc. Again, we are reviewing the assessment communication section in the plan. As we said before, we checked the box off with the assessment section stating that a tech assessment should be completed to see if Lou is able to explore using an iPad or any other type of technology. This would be considered a new professional referral. When we say new, you have John Smith listed. He's our tech vendor. And then list the reason for the referral. We need to explore additional technology options for Lou to help him with his communication is safety and the access to new experiences and relationships. This next slide is an example of an outcome using technology. Meet Veronica. This plan can also be found on the OhioISP webpage. To kind of give you some back history, Veronica really struggles with receiving, instructions from staff and likes to do things on her own. Veronica really wants to reduce her dependence on staff and wants to increase her independence. So if you look at the technology role again, this is really one of the criteria for using technology. When we review the summary of progress for this outcome, we want to make sure that we're including any types of success, progress, any accomplishments. And for Veronica, we see that she's been using an iPad for 6 months and is doing well completing tasks independently. So that's really important to put there. Veronica's overall outcome is that she wants to do everyday tasks independently without receiving instructions from staff. So when we move to the next section, you will see details to know. And at this time, team felt that it was important for everyone to know that Veronica uses her iPad for many other things and can do it very efficiently. A discussion with the team members took place, and they're really looking on how Veronica can, become more independent using technology. Her team reached out to a technology specialist and completed a technology assessment. After the assessment was completed, it was determined that specific applications could be downloaded to her iPad to increase her independence. And then once downloaded, the application could be customized to fit Veronica's needs and wants. So what needs to happen? How should it happen? Who's responsible? When and how often should it happen? In Veronica's case, a DSP is to give her a reminder to go get her iPad before getting ready for her nighttime routine. Veronica is to utilize the application on her iPad and then follow instructions. How should it happen? The SSA or the QIDP should go into detail with each step, letting everyone know how the steps are to be happening, and the steps should be clear and easy to follow. So who is responsible? Anyone who is responsible for assisting Veronica with her outcome should be listed. When and how often the SSA or the QIDP want to make sure that the steps are measurable by being concrete and, spelling out when it's to happen, how many times it's to happen. This way, you're going to be able to measure the progress. When reviewing plans, there's always room for improvement. On Veronica's plan, we really could have done a better job with who is facilitating the use of technology solution and who is responsible for what. In her plan, we really don't go into enough detail like who's responsible for making sure that her iPad is always charged. We don't spell out if something's going wrong, her iPad's not working, or the application's not working. We really don't tell you who to contact. So again, we could have done a better job with that, and we're just going to go back and we'll add that information. So this is Veronica.
On the DODD website, we have a really great technology first set of resources that you're welcome to click on and run through. I'm going to point out that this is the home of where you can kind of take a peek at the Ohio Tech Ambassadors, which is a great project we did to kind of help people, families, SSAs, providers, and people we support kind of learn about the lived experience of supportive tech. So we have about 8 people with disabilities who use tech who are ready, willing, and able to come out to your meeting or or your event, or even online, or they've made videos, etc. And you're welcome to kind of invite them to come to any kind of event, and they'll talk about how supportive tech has improved their life, and also kind of walk you through the way they use it and some of the apps they use, and the kind of equipment they use. So that's a really good way for to get rid of some of that fear and talk about the benefits of supportive tech. So there's the link to that. And then we also have a great, on the website now, a video playlist of about 95 videos you're welcome to look at, short clips of people using tech, talking about tech, just a really good resource to kind of walk people through what it means to kind of be tech first. There's all other kinds of resources and benefits you can check out on the Tech First page. I also wanted to point out the rapid response system that we've kind of put up for folks to use. It's for SSAs and QIDPs and technology vendors to kind of come together. And basically, it's a gateway for folks to kind of put out what's needed and then have a response, a supply and demand. So it allows SSAs and QIDPs to create a ticket for people in the need of tech solutions and consults. And then the tech vendors on the other side are able to see those requests and respond outside of the system directly to the requesters. Right now, County Board SSAs have access to it, but coming soon, real soon, QIDPs and Developmental Center folks will be able to access the system as well. Wanted to invite everyone that's interested in tech first and supportive tech and tech as a solution to people's needs and wants. We have a tech summit coming up at the Renaissance Columbus in Westerville at the Westerville Polaris Hotel on August the 12th. And you can kind of register now and be a part of this celebration with lots of vendors, people who use tech, people who are interested in tech, just kind of coming together and kind of having a day of just embracing the future. Also, wanted to let you know about monthly Tech First updates. They come out toward the end of every month, and they're chock full of stories about supportive tech and new apps to try, and basically just a catch-all of everything tech that you can go to and benefit from. So you can, on this link, you can register for that, and it'll be in your email mailbox monthly. So definitely worth the time to do that to get in the know.
So in closing, we want to give a few reminders. Statewide office hours will be July 26th. If you are an SSA, we will begin at 11 a.m. and go until noon. If you are a QIDP, we will start at 12:30 p.m. and go until 1:30 p.m. Coming soon, we will have more information on August gathering, so be on the lookout for that. If you have a question on technology, please reach out to Keith Banner. You can find him at keith.banner@dodd.ohio.gov. If you have questions concerning technology and the OhioISP, please reach out to OhioISP@dodd.ohio.gov. Thank you so much for joining us, and until next time, we will talk to you soon.